couple of other infectious illnesses that don't really fit neatly into any category, so I'm just going to kind of put them all together here. But you want to look at your general signs and symptoms of your infectious illnesses: skin ulcers, sore throat, mouth sores, eye inflammation or mucous membrane inflammation, dry cough, weakness, especially pneumonia, things like that. Things that you want to consider as potential problems. So meningitis can be viral or bacterial, and it's an inflammation and swelling of the meninges that surround your central nervous system. Now, viral meningitis tends to be a little less severe, and bacterial meningitis can be fatal. Now, the incidence of your childhood meningitis has decreased a fair amount since the vaccine became available, and there is also a vaccine for your meningococcal meningitis, which is recommended for high-risk populations such as adolescents or young adults, especially going into college, who are going to be spending a lot of time with other people of the same age. Now, the meningococcal bacterium commonly resides in the nasal passageways, but normally doesn't cause a problem, it doesn't cause disease. But in circumstances, usually in the winter months, this bacteria can actually gain access to the CSF and cause your meningitis. Viral meningitis tends to occur more often in the summer and fall. Now, the early signs of viral and bacterial meningitis are similar, but bacterial meningitis very quickly becomes more severe. And your signs and symptoms are going to be fever, headache, photophobia, where the lights really bother you, and nuchal rigidity or stiff neck. And in bacterial meningitis, you can have seizures and altered mental status as well. You may have some other signs and symptoms if it's entered the blood, which is the meningococemia, and this causes damage to the blood vessels, which results in bleeding into the organs and the skin, which we call purpura. Other signs and symptoms could be fever, chills, vomiting, diarrhea, joint and muscle pain, tachypnea, cold hands and feet, so things that are very similar to some other infectious respiratories as well, or infectious illnesses as well. So with our patients, for bacterial meningitis, is typically transmitted through contact with the nasal or oral secretions, and generally requires pretty close contact with that infected person. It's not highly likely that it would spread from patient to EMS provider, but it does. The potential is there and it does exist. So you should wear a mask in addition to gloves, and probably some eye goggles or face shield, for your standard precautions. We're going to treat these patients symptomatically. So if there's a problem with hypoxia, we're going to fix it. If there's a problem with sepsis, we're going to treat it. If there's a problem with hypotension, we're going to treat it. So we're just reactively treating this patient with whichever is going on. As far as encephalitis, this is an inflammation of the brain tissue itself. Now, your more common causes are going to be like your domestic arboviruses, like West Nile and St. Louis encephalitis and Eastern equine encephalitis, which are usually tick-borne or mosquito-borne illnesses. Now, there are some other ones like herpes virus and toxoplasmosis, and with your patients who have compromised immune systems, that can cause encephalitis as well. Your signs and symptoms, very similar to your meningitis. So treat symptomatically. Now, your GI infections, these are foodborne or waterborne pathogens, and they can also be transmitted through your oral fecal route. So some of your more common causes could be, they call them like stomach flu, but it's not the flu itself, it's the stomach bug, I guess, would be a little bit more accurate. But your more common causes would be salmonella, E. coli, the norovirus. The norovirus is that one that's usually responsible for getting literally boatloads of people sick on cruise ships and things like that. And the staph bacteria. Signs and symptoms: abdominal cramping, nausea, vomiting, diarrhea, sometimes a fever. These outbreaks can be traced to a specific source, or they may never figure out where it is. Most cases are self-limiting, but in severe cases in very small children and elderly can result in significant dehydration and even death in severe cases. There is a particularly serious side effect that occurs in a minority of cases with E. coli, and that's hemolytic uremic syndrome, and this is where the red blood cells are destroyed, resulting in kidney failure. Cholera is maybe one of the more recognizable severe forms of gastroenteritis. Any kind of a disaster that impacts water sanitation, it can occur, but it's fairly rare in the United States. So with these patients with gastroenteritis, we're going to check for signs of dehydration and shock. We're going to check our skin turgor. We're going to look at vital signs. We're going to start an IV for patients who can benefit from fluids. You may want to consider an antiemetic, odonstrine, something like that, for severe vomiting. who you want to treat for shock, managing that airway and ensuring adequate ventilation and oxygenation. Now, botulism is a whole other thing, and this is a bacteria, and it produces a neurotoxin, and it can be found in low acidity home canned goods. If you ever do any home canning, you know that there's like a magic recipe, a ratio that you have to get of acidity in your canned foods so that you don't risk killing people with the stuff that you've canned or made jelly with or something like that. So when they are not properly processed or cooked, it can cause paralysis by blocking the release of acetylcholine in your motor neurons. It's not common, but there is some concern about it potentially being used as bioterrorism at some point. It can also infect the skin of your IV drug abusers, and the cutaneous infection can become systemic. A couple other things about botulism. If you've ever heard of Botox, this is the same bacteria, but it's a slightly differentiated version that they use, the medical version of it, but they use it for its paralytic properties, and they use it to paralyze muscles. When the muscles don't move, you don't get wrinkles. With infants, they are at the highest risk of botulism from 6 weeks to 6 months, and this is usually from eating honey or dirt or something like that, because it's all around us, but most adults can handle it, and small amounts can be eliminated from the body without harm. This is why if you ever have a baby, they tell you don't give that baby raw honey for the first year. Now, mono is a viral infection. It's also called the Epstein-Barr virus. It causes fever and fatigue, and it's going to affect the upper respiratory system, involving a sore throat, swollen tonsils, and enlarged, painful lymph nodes. It also can affect the phagocytes in the spleen, so it can result in an enlarged spleen in a lot of your patients. It's transmitted with direct contact with saliva. Okay, so it's not respiratory transmission. It has to be transmitted with saliva. By adulthood, about 95% of the population has been infected and developed antibodies at some point with mono. It's fairly common around teenagers, sharing drinks or kissing, which is why it's known as the kissing disease.